Hey guys, Brandon Lee here, and I've got something super exciting for us today. Okay, so I actually just had the pleasure of sitting down and speaking with an extremely intelligent individual. She's an 8th year master's, a registered osteopath. She has her own practice out in Guelph, and her name is Stephanie Froll. So basically, I posted some pictures on Instagram a few weeks ago of me receiving some osteopathic treatment, and it sparked a lot of questions. A lot of people started asking, "Hey, Brandon, what is that? Is that right for me? Will it help me be a better athlete? Will it help me with this injury?" And a lot of other questions of that nature. Rather than me trying to answer them and taking just random guesses, I figured, hey, let me just get the professional here and maybe she can answer these questions for me. So that's what I did. So I asked Stephanie, I said, hey, would you mind sitting down for an interview, maybe set up a camera? And lucky for us, she said yes. So that being said, what you're about to see is just a short little interview. We're just barely scratching the surface. We're going to talk about everything from the origins of osteopathy to what it is now. How is it different from other physical therapies, and how it can perhaps benefit you. So I hope you guys enjoy this, and stay tuned. And I hope to release more videos like this in the future. So make sure you like and comment and let me know what you think. Okay, guys? Okay, have a great day. Talk soon.
Do you want to lead?
Okay. Clapping doesn't do good. What's up, you guys? Today I'm joined with Steph, who is my osteopath, and we're going to get to learn a little bit more about the study of osteopathy and how it can potentially benefit you as an athlete or even just an everyday person. So, Steph, how about you introduce yourself and let us know your background and kind of like that kind of stuff.
Yeah. So I'm Steph. I'm an osteopathic manual practitioner. I've been working with Brandon for 3-4 years, maybe longer even.
It's been a while, yeah.
Yeah. So originally I started out in a human kinetics program at the University of Guelph, which is also one of the main reasons why I practice in Guelph currently. After Guelph, I ended up at the Canadian Academy of Osteopathy out in Hamilton, where I started my career there. So the way that the program is structured for osteopathy at the CAO is actual hands-on. So I have more than 4,500 hours of experience. I've worked in a free clinic out in Hamilton through the school for the past 4 years, and I recently opened up my practice here in Guelph as of this past February. Yeah.
It's you're a 7th year master's? 7 or 8 years?
So it's 8 years. So my HK degree is a 4 years bachelor's honors, and then my CAO program is another 4 years on top of that.
Wow. So as you can see, she's an expert. So when it comes to my body, I would only trust now, how are some ways that osteopathy would differ from, let's say, something more common like chiropractic work?
Yeah, so I actually get this question a lot. How does osteopathy compare to all the other modalities that are out there? So we have things like fascial stretch therapists, we have RMTs, we have ART, right?
Active release, yeah.
Yeah, we have chiros, physios, we have all kinds of different modalities that are the manual stuff. So the main difference between, say, me and an RMT is that I work on all of the layers. I work including the articular. I'm looking at how everything flows together. It's more of a holistic complementary healthcare. And I guess a lot of people ask, like, how is it different from chiro? Because they work on all the layers as well. Actually, a lot of chiros are starting to kind of come the same way with the same kind of principles as we do. In particular, I like the chiro that I work with in my own office. She's phenomenal, and she works on the same principle that the body is self-healing and self-regulating. Now, a lot of chiros still use the high-velocity, low-amplitude thrust maneuvers or the cavitation work.
That's like when there's a big crack, right?
Yeah, so that's something that you would see. All you have to do is basically go onto YouTube and look up different maneuvers, and you'll see there's a lot of torque and thrust put into the motion. Whereas like with osteo, we don't do any of that kind of work. It's all low velocity stuff.
Yeah.
So it's never going to be forcing the joints back into place. It's more so manipulating the structure surrounding it to make it want to go back. And it's not just making what hurts go away, but also looking at everything that is possibly underneath and underlying that could be contributing to it. So, for example, a lot of my clients can attest to this, where they'll come in with something like, say, a shoulder issue, and I won't even touch the shoulder. I'll work on like the hip or the knee or the ankle, and then this resolves on its own. So you can kind of tell things don't necessarily originate in the same place that they express themselves.
Yep. And that's something I've experienced with you myself, is you're very good at kind of working your way through the different links of the chain to get to the actual origin of the problem. So, and back to what you're saying too about the low impact stuff, that's another thing that I also noticed and have experienced through treatment with you, is that there's never any forced movements. And I could be mistaken with this, but I feel like you work simultaneously with my nervous system and with my natural structure, as opposed to forcing things in a position they may not want to be in at that time, or in a position that they can sustain for a long period of time because of those other links in the chain that we were talking about. So that's just my interpretation of it. But yeah, so needless to say, osteopathy is definitely very high up on the totem pole as far as my opinion goes, and I believe if you've tried it yourself, you would agree. So how can regular treatment perhaps help somebody who's trying to be their best self? We'll start with like the athletic side of things. So if somebody's trying to be a top tier athlete, how would osteopathic treatment benefit someone like that?
Yeah, so there's different treatments for different individuals, but if it's for training purposes, the main focus of treatment is going to be on movement and increasing both the quality and the quantity of movement so that you can perform at the top level, whereas treatment for someone who's injured is more so about stimulating the healing process and working with the nervous system, all that you've mentioned before, and it's all tailored uniquely to the individual. Even with athletics, it's still tailored to the individual. It is personalized healthcare.
Yeah. Well, one thing I've noticed too in working with you is after treatment, I've now got an increased range of motion and a better distribution of the load. And the most proven way to increase at least hypertrophy, which is what I focus on as a bodybuilder, is you want to increase not only the range of motion within a safe range, but also maximize the load. So if I can evenly distribute the load across a greater range of motion, that would obviously be optimal for stimulating more muscle fibers and in turn developing more muscle. I would imagine the same principles would apply also to like explosive sports such as powerlifting, Olympic lifting, sprinters, runners, all that kind of stuff, because if they're able to more evenly distribute their force in a more balanced way, would that not translate over to their sport? I believe it might. I'm not an expert on that, but simply speculating, I think that would definitely be the case. So needless to say, most athletes could benefit from this. And how often do you recommend people get treatment?
So it's going to be specific to your situation and what your needs are. But if you don't mind, if I could expand on what you were just kind of talking about.
Absolutely.
Yeah. So when you talk about like the loading and all of that, like loading your gravitational field, basically it's readjusting so that gravity and your force and load are through your joints in a way that it's most efficient for your body to handle the load and to produce your maximal force. Now, on top of that, rather than just being mechanical, there's also chemical components, there's the fluid component. So in order to lay down new tissue, to break up scar tissue, to heal from injury the same way you would lay down new tissue, you have to have the blood supply, the proper venous drainage, the circulation. You have to have good waste removal and proper nutrient supply.
Yes.
So the one thing that is required, and one of the things that actually one of the Andrew Taylor Still, who is the founder of osteopathy, says is the artery reigns supreme. Now, he doesn't mean that the artery itself is more important than anything else in the body, but what he's talking about there, or at least from my understanding, is that if you look at things, you actually need an arterial supply before you can lay down a nerve, before you can lay down a muscle. So you need to have that. And there are specific arteries for arteries, so it's called the vasa vasorum, and then there's for nerves, there's for everything. So you have to lay down like its own arterial supply to supply the muscular component of the artery even.
And that does play into it too. That makes complete sense, because in terms of like you said, recovery and developing tissue, there has to be that flow of fresh nutrients. We all know the more blood you send to a muscle, the more nutrients, the more oxygen it receives, the bigger it will grow. That being said too, when something is seized up or stiff or not receiving proper circulation because it may be impinged or impaired, having the treatment from an osteopath such as yourself would help open that up and alleviate those tight muscle fibers and allow fresh nutrients to flow in. So that's a completely different aspect I didn't even think about in terms of how effective an osteopath can be for an athlete's recovery as well as their performance.
Yeah, and even in your own case with your hip being locked up, you have to think the whole like supply to the leg goes right down under the inguinal ligament. Mm-hmm. So if you have, say, like a contractured psoas or hip flexors, you're actually impinging on that ability to bring nutrient supply to and proper waste removal away. Then the next thing you know, you've got atrophying, you've got pain, you've got spasms, you've got nerve pain, sciatic pain, and the list goes on. The issues just eventually build up, and it's not even just going to be localized to the one hip, because now the rest of the body has to compensate for what this can't do. Mm-hmm. And then you end up with all these patterns. And it's when you fall apart that I actually see you in my office.
Just speaking about me personally, yes. And that ties into, like we were saying, the different links of the chain. So like what can start off as something so small, as your body compensates to deal with that issue, it can obviously rapidly develop into a whole chain and list of issues, which I've experienced a few times by waiting a bit too long between treatments. So I guess you're right, it would be very individualized for how often. Now, let's say someone is training for a competition, let's say, okay? Mm-hmm. And so they need to be in their peak performance, their most optimal, performance. Would once a week be a good recommendation to come visit you? Because then at least you can make sure everything's staying aligned, everything's receiving proper flow in terms of nutrients and blood and everything. Would that be too much, or would twice a week be better for that person?
So it's going to depend on the sport, right? Mm-hmm. So if you're powerlifting, you're bodybuilding, that kind of thing, the only issue with being too frequent is that you can't do heavy lifting within the next like 24 to 48 hours after osteo. Mm-hmm. And that's just because you run the risk of destabilizing and potentially injuring yourself as things are trying to reset into proper place.
Yes, that's right.
So that could be a component that you're not too keen on in training. So usually when it comes to high performance, I would like it to be actually around like the 2-week mark rather than the 1-week mark. The 1-week mark is more so for someone who's in a chronic condition that needs to have that needs the work to open up the supply to break down a lot of scar tissue that's been there a long time. And it's kind of like trying to peel the layers off of an onion or sand down the edges of a stone. You're constantly working towards the center.
That would make total sense too in regards to they're not training as frequently as an athlete would be. Right?
Yeah.
So that does make a good sense. It's a very good point. Okay. Now I'm running out of ideas here. I feel like I've already learned so much. Is there anything else you'd like to kind of expand on, or?
Not that I can currently think of.
Yeah. Okay.
Yeah.
Well, I think that's enough for one day, you guys. So thanks for checking us out, and make sure I'll link all of Steph's stuff in the bio as well, so you can get in touch with her. If you're in the Guelph or Cambridge, Waterloo, Kitchener area, Tri-Cities, I do strongly recommend getting in touch with her for a limited time. correct me if I'm wrong, you're doing the first one's free?
Yeah, so my free initial assessment and treatment is actually limited time. It's currently free. However, that will be changing in the near future. It'll probably be around the December mark.
Okay, so you guys have until December to get in here and work with Steph for free for your first time. And I promise you, after you meet with her and talk with her, I'm sure you'll be a returning patient or client. So anyways, guys, thank you for your time today, Steph. Thank you for everything. And we'll see you guys later.